Welcome back to Fourth Level Surgery, textbook edition.
I'm the greatest in the game. Everybody knows my name. Put your hands in the air, fellas. And all the ladies do the same.
In this episode, we're covering Chapter 8, Emergency Situations and All Hazards Preparation. Emergencies in the operating room are rare, but when they happen, they're critical, and your job as a surgical technologist isn't just to assist, it's to act immediately, think clearly, and help save lives. So we'll walk through how to respond to patient emergencies during surgery, understanding high-risk conditions like malignant hyperthermia and anaphylaxis, and prepare for large-scale disasters from natural to chemical to biological events. So I'm sure we all know emergencies don't announce themselves with a flashing sign, right? They appear suddenly, and your ability to recognize the signs early can change the outcome. Indications of intraoperative emergencies may include sudden changes in heart rate or rhythm, cardiac dysrhythmia, hypotension or cyanosis, which is the bluing or the deoxygenation of the blood that you can see through the skin. You can see that the skin starts to turn like a blue color. Inconsistent oxygen saturation, so when those O2 stats drop. Unexpected bleeding or swelling somewhere on the patient. You must stay alert to the patient's vitals on the monitor. No matter what anybody says, pay attention to that, right? You got to anticipate the surgeon's needs during critical interventions, which if you pay attention to that monitor and see changes, you're able to anticipate. And then know how to activate emergency protocols and assist calmly under pressure. Because the anxiety and stress in the room between everyone is not helpful. You have to remain calm. Trust me, I know from experience. Every surgical technologist must be certified in BLS or basic life support and understand their role during CPR, cardiopulmonary resuscitation. If a cardiac arrest does occur, you want to call out the emergency clearly to the team. If you are scrubbed in and cardiac arrest does occur in the patient, there's some things that you want to do. You're typically scrubbed in, so you want to make sure your back table is safely pushed away from the sterile field. If necessary, you may need to assist in chest compressions. Clear the patient of any instrumentation or supplies to make room for any defibrillators. And you typically won't be leading the code, but your speed and clarity and support in those tasks are very vital. Malignant hyperthermia. It is rare. It's an inherited disorder triggered by certain anesthetics and muscle relaxants. I have not experienced it with any of my patients, but when it does occur, a rapid extreme rise in body temperature happens. There's muscle rigidity, severe metabolic imbalance, and then potential death if not treated immediately. You have to act quickly with malignant hyperthermia. So something you need to do is recognize the signs. Everybody in the room should be aware of the signs. So increase end tidal, CO2, tachycardia, muscle rigidity again. Now this is something that your anesthesia provider will probably notice before we do surgically. And when they do notice, they will alert the entire team of the crisis that is going on at the moment. They will administer dantrolene, which is the only effective treatment for malignant hyperthermia. We'll be expected to have some type of ice pack or cooling blanket. If you have cold fluids on the field, every single OR should have an MH cart, and you should know where it is. Honestly, everyone on your team in your department should know where it is. But since it happens so rarely, I always suggest that if you're not familiar with the policy, I suggest reaching out to your educator or manager and ask if you guys could have a refresher for the MH policy at your facility, because if you don't use it, you lose it. And if you've never experienced it, how are you supposed to know what to do? So DIC is a clotting disorder where the body forms clots, using up clotting factors, leading to uncontrolled bleeding. We don't want uncontrolled bleeding. Nobody gave heparin. It can also result from trauma, sepsis, obstetric emergencies. Intraoperative signs may include unexplained excessive bleeding, bruising, very abnormal clotting times on labs. And in our role as surgical technologists, we want to prepare hemostatic agents, ensure that instruments are ready for bleeding control, make sure you have hemoclips, some type of suture maybe. You know, DIC is serious and it requires rapid, coordinated response. One that we're more familiar with is anaphylaxis, which is a life-threatening allergic reaction that can occur during surgery due to latex allergies, antibiotics, or even anesthetic agents. Now the sides could include difficulty breathing or wheezing, of course, before the patient goes to sleep, low blood pressure, skin rash or hives, swelling of the face or the airway even. And as the surgical tech, you must know whether the patient has any known allergies. That should be discussed during the timeout. Respond immediately to signs of anaphylaxis. And honestly, just always verify allergy status before the procedure. Before you start setting up, know what the patient's allergies are, because that could alter just what you set up and prepare for the patient in the room that day. So all hazards preparation include any large scale event that disrupts, normal operations, such as natural disasters, so your hurricanes, your earthquakes, your wildfires, your tornadoes. Then there's the human caused events, so terrorism and an active pewer or radiological accidents. Then we have the hybrid disasters, events where natural and human factors kind of overlap, like floods that cause disease outbreaks. And during these events, surgical technologists may be called to assist in trauma care, set up and maintain sterile conditions in alternative locations, be on call, be on standby, provide support in decontamination, or help with emergency inventory, supplies, and communication. You have to remember that you're not just a scrub tech. In the rare event of a radiological, chemical, or biological attack, surgical techs should follow decontamination protocols, know how to use PPE or personal protective equipment, make sure you're working under infection control guidelines for highly infectious patients, and just like every other situation, remain calm, focused, and just ready to adapt and pivot as needed. The best thing you can do is be familiar with your facility's disaster plans and policies. So to sum that all up, Chapter 8 kind of taught us that emergency response in the OR isn't just about what you do, it's about how fast, how calm, and how confidently you do it. From malignant hyperthermia to mass-casualty response, your ability to recognize the danger and step into action, right, can mean the difference between life and loss. Emergency preparedness is a skill that you build before a crisis ever happens. Be prepared. In the next episode, we will explore Chapter 9, one of my favorites, wound healing and surgical site management, where really you'll learn how the body kind of repairs itself and how we surgical techs are right there to support every stage of that. I feel like Chapter 1 through 8 were kind of the meat and potatoes, the boring stuff. From 9 on is when it really gets juicy. So I hope you guys stick around. If you have any questions, please, of course, like always, drop them down below in the comments. Make sure you subscribe, hit that notification bell so you can be notified when the next video is posted. Like this video if you did. Don't thumbs down it. I guess if you didn't like it, thumbs down it, but actually don't do that. Also, follow me on TikTok and Instagram at For the Love of Surgery on TikTok and _ For the Love of Surgery on Instagram. I post there daily, honestly. So if you want something more consistent, please check those other platforms. I also post daily CST exam prep questions on TikTok, so you can definitely tune in for that. And again, like I said, till next time, bye!
I'm the greatest in the game. Everybody knows my name. Put your hands in the air, fellas.